Welcome to section 11.2, where we're going to discuss how skeletal muscles get named. So our skeletal muscles are named according to a lot of different criteria. First, it's based on muscle action. So depending on what that muscle's primary action is, we can use terminology to name that muscle. So for example, we have the flexor digitorum longus that is going to flex the digits. So flexor obviously means it's going to flex something, whereas the term extensor means it's going to extend a joint. Adductor adducts a part of the body, and abductor is going to abduct a part of the body. So back to our example here, we can also use other terms in here to make it clear exactly where those actions are taking place. So flexor digitorum. Digitorum is referring to our digits, typically 2 through 5. And then longus, we're going to talk about that term in just a little bit, but it just means that this one is long and there's another muscle that does the same thing that is shorter. Next, we have our specific body regions. And this is going to be a criteria in which we can use to name muscles that helps us name it based on where that muscle is located. So our example is the rectus femoris muscle. We know that rectus means straight and femoris means thigh. So we know that this muscle is going to be somewhere in the femoral region in the thigh. We have some other terms listed here for you. Oris referring to mouth, cervicis referring to the neck, brachial referring to the arm, carpi always refers to the wrist, pollicis refers to the thumb, gluteal refers to the buttocks, femoris refers to the thigh, hallucis is the great toe or the big toe, anterior is going to mean closer to the front of the body, posterior or dorsal or dorsi is referring to the back of the body. Superior means it's closer to the head. Inferior means closer to the feet. We can also use the terms cephalic for superior or caudal for inferior. Then we have superficialis, which means it's more superficial, and profundus, which means it's deep. And you're going to see these used throughout our discussion of the muscles in the following sections. Now, our next criteria is where are these muscles attaching? So we named them after either their origins or insertions or both. So our example for this is the sternocleidomastoid muscle. If you turn your head to the side, you might see this muscle stick out a bit. And if we break the term sternocleidomastoid down, sterno is in there because this muscle originates from the sternum. Cleido is in there because it is also going to originate from the clavicle. And the mastoid portion is in there because this muscle goes and inserts onto that mastoid process behind the ear. Some other examples would be intercostal, which means between the ribs, subscapularis, which is referring to the subscapular fossa, fibularis longus, which is telling us this muscle is attaching onto the fibula, and then zygomaticus major, which lets us know we have attachment on the zygomatic bone. Now, our other criteria can be its orientation of muscle fibers, so that we're looking at those muscle fascicles and in which direction they are moving. So we have our example of the rectus abdominis muscle. Again, rectus means straight. So we see these fibers going straight down the abdomen. And we can also use terms like oblique, like we see over here, our external oblique. That means that these fibers are angled or in a diagonal. And we have orbicularis, which means circular. So we've seen this example before, orbicularis oris going around the mouth. And here we have orbicularis oculi, meaning it's circling the eyes. And here is our last slide on muscle naming. So next criteria is the muscle shape. We can look at the deltoid muscle and see that it's shaped like the triangular delta symbol. Another example is our abductor pollicis longus. Remember, we said that term longus means that it is long, whereas if we have the term brevis, that means it is short. And typically wherever we have a longus, we have a brevis. And there are some other muscles in our body too, like the trapezius, which is kite-shaped. It was named after the shape trapezoidal. And we also have our quadratus, which is going to be meaning it's four-sided or like a rectangular shape. And then we have a nomenclature based on muscle size. So sometimes we have several different muscles that either do the same thing or are found in the same region, and we differentiate them based on size. Best example for that is our gluteus maximus muscle, which you find in the gluteal region, of course, and that one is the largest of all the buttocks muscles. And then deep to that, we have the gluteus medius, which means it's the medium-sized gluteal buttocks muscle, and minimus, which means it is the smallest of those gluteal muscles. We can also use the terms major and minor. Major meaning it is larger of the two muscles that are related or close in the same location, and minor meaning it is the smaller one. And lastly, we have the number of muscle heads at an attachment site. This is telling us the number of muscle bellies or heads that we're going to find at the superior or proximal attachment site. So for example, we have the triceps brachii that has the 3 different heads. We have the biceps here, which has the 2 different heads. And another example of that would be our quadriceps muscles, which have 4 heads. And we find that in the anterior thigh. Now for a little bit of a clinical view on intramuscular injections. This is just one route of medication administration, and it may be inserted into a muscle with the syringe that you see pictured over here. This delivers medication to our cardiovascular system through the muscle's blood vessels, and it also allows a large amount of medication to be given at one time. We can also ensure a slower, more uniform delivery than oral or intravenously. So this is typically used for vaccines. For example, that COVID vaccine right now uses an intramuscular injection. Sometimes it is used for some contraceptive medications and some antibiotics as well. And some common sites where you can give this intramuscular injection would be like the deltoid, the gluteal region, and it can also be within the quadriceps, so either within the rectus femoris site or the vastus lateralis. You typically want to give it in a region that has a large muscle within it, and the patient may have some pain or stiffness within that area for a day or two. And when you are giving an intramuscular injection, the steps you want to take is first, of course, you want to wipe the area with an alcohol wipe, and then you're going to use your thumb and your pointer finger to kind of open up the area and hold the skin taut, and then you would inject the needle like we see up here at a 90-degree angle. I don't know why both of these are blurry, but you want to go straight in at a 90-degree angle. You're going to pull back the syringe to make sure that you are not within an artery or a vein and make sure there's no blood. And then if you see that there's no blood, then you can continue with that injection. And then once you have injected all of the medication or vaccine, then you're going to pull back your syringe and of course discard it within a sharps container.